Hello, everyone. My name is Paul. I'm a licensed physician assistant practicing at Baylor Scott and White's cardiology department in Uptown Dallas. I'm here to give as much information about cardiology in hopes that you will all learn and more and can teach others as well as yourselves, um, based on the information I can give to you. And you can take this home and make sure that you continue to learn on it. So I came into this profession because I want to be able to wake up every day knowing I'm helping people who are in need, knowing I'm helping people who want to be helped and who need my help. I want to make a difference in this community. This profession is very interesting to me and very rewarding. You learn a lot more than you think, and I don't think I'd rather be doing anything else. This is what I think I've always wanted to do. The cardiovascular system is something I focus on most of my shifts because it's an organ system that permits blood to circulate and transport nutrients through the body. Without it, we would not be able to avoid blood clots and would suffer from things like cardiac arrest. When you hear the cardiovascular system, you can think of the circulatory system and the vascular system as other terms meaning basically the same thing and just different ways of saying it. Your blood's very important to you living a healthy lifestyle and needs a healthy flow. When long-term force of the blood against your artery walls is high enough, you'll be more susceptible to things like heart disease and high blood pressure. Your heart does a lot of things and is a large part of the cardiovascular system. If a plaque were to rupture in your heart, a blood clot can form and clot your arteries, causing a heart attack. To prevent all of this, you need to keep your heart strong by sticking to a good diet regimen and also making sure that you exercise to keep your heart pumping and your blood moving, which is all part of the circulatory system and function to transport blood through your body. When your heart's beating too quickly or too slowly or with an irregular pattern, you'll be experiencing what's called arrhythmia. Arrhythmia has to do with the rate or rhythm of your heartbeat. So if you experience symptoms including a fluttering in the chest pain, fainting, or dizziness, you should go see your cardiologist. When your heart rate is slow, you might be experiencing bradycardia, which differs with your age and physical condition. So based on you being a certain age and you not exercising often or you exercising often, will be how your doctor will say, okay, your heart rate is supposed to be this fast or this slow. If you're experiencing this, it's recommended you go see your cardiologist immediately. If you see or experience bluish discoloration on your hands or your feet, you might be suffering from cyanosis. Cyanosis is usually caused by low oxygen levels in a person's red blood cells or problems getting oxygenated blood directly to your body. To avoid it, you want to stay away from wearing tight clothing and being exposed to cold temperatures for a long time. Like if it's snowing outside, you don't want to be standing in the snow unprepared with your skin exposed because this will be something that may make you more susceptible to cyanosis. A lot of people might get cyanosis mixed with palpitations, which will increase your heart rate and make you feel like you're skipping heartbeats. So these things might be mixed into one. It can be caused by smoking, use of marijuana, alcohol, or even some prescribed medications. So if you experience this, it's a good idea to ask your doctor about your medication and hobbies. And it's probably also a good idea to do what I said in the past and make sure you're staying out of things like the cold. So, and your heart, for me, in my experience as what I do, I think it's very important for you to study the cardiovascular system, and we should all make sure that we participate in the studying of your heart and this entire system. Whether you're experiencing cardionia, a condition associated with pain in the region of the heart, or temporary loss of consciousness, usually associated with insufficient blood flow to the brain, scientifically called syncope, you should make sure you check in with a cardiologist and make sure that you do your research. Thank you.